Welcome to our vaccine special. I'm here today with Lexington 2 Superintendent Dr. Nicolas Wade, and I'm here as well with Chief Administrative Officer Jim Hinton. And we are going to talk about Lexington 2's vaccination plan as it stands today. Dr. Wade?
Yeah, probably a few things, as I'm sure you probably have a few questions, is, right now there's obviously a lot of fun confusion out there about who's going to be responsible for disseminating the vaccine, especially, to our staff members, and then obviously beyond that, what kind of happens with students and community members. And we really want to be able to kind of share out with people that we do have a vaccination plan, like we have it logistically set up, and we feel it's appropriate to go out there and be able to communicate to everyone about what are some of the realities of that and what we can actually do. Thanks to Mr. Hinton and his team. But right now where we currently are at is we don't have access to the vaccine. There's obviously some indirect or direct expectation that school districts are going to have to kind of take the lead on it. And I just want to be able to kind of go out there and share with all of our stakeholders that we do logistically have a plan should we be called to action in order to do it. So that's kind of where we are at right now.
Can you tell us a little bit about the plan as you see it right now?
Sure. Right now, one of the things that I think we're very much fortunate to have is, we do have the facility space to, not only kind of be able to have a drive-through in an area for people to get vaccinated, and obviously, monitored or supervised, even shortly thereafter. We even have a location where we can kind of have a cooler that can actually house, the vaccine as well. We feel like that logistically we're able to kind of work out everything in terms of the amount of time it would take, the number of nurses and clerical staff to see it done. Pretty much our only real disadvantage at this time, and Mr. Hinton can correct me, but it's really being able to make sure that, aside from getting the vaccine, it's also getting the syringes in order to actually administer it. So I know we're struggling on that end, as is everyone, but.
So I know one thing that's come up is, are we going to require all Lexington 2 employees to have vaccinations? Is that something that's been decided?
I think that's for the courts to decide. I think I'm gonna let them figure that out. But I will say this, we did issue out a survey because the Department of Ed requested it. And we had, of our 1,300 employees, we had 1,000 respond. 3/4 of them said that they were interested in taking the vaccine. So that's kind of where we're hovering at. And obviously, if we have the opportunity, we're going to be doing our best to make sure that we go out there and let everyone know that this is available, and we want to make sure it's accessible to all.
I know one of the things we've heard about is that each school district may have a partnership hospital. Do we have one at this point?
We do, and I'll let Mr. Hinton kind of talk about that a bit.
When we first started 1A, there were certain employees that were in Lexington 2 that qualified. Our school nurses, our speech therapists, our OT and PT personnel. We worked with Lexington County Medical Center outreach program. We actually sent them a list of all of those positions, their names and emails. They then put them into the VAM system and sent an email for each one of those to go in, fill out their requirement, select the time they'd like to come, and then go with that day up to Lexington Medical Center. The VAM system is some people think it's difficult, but it is a way to where you can go through and pick and choose partnership where you want to go get it done. And there's vaccination sites all over Lexington County. Go back to what you said about should everybody take the vaccine.
Mm-hmm.
Anybody that has any questions, whether they want to take the vaccine or should they take the vaccine, they need to talk to their healthcare professional right now and go ahead and get all that stuff out of the way. For example, when you come through, there'll be a series of questions that will be asked. One is, do you have allergies? Have you ever had an incident taking the flu shot or the pneumonia shot or something like that? The other thing that is that you use an EpiPen. So there won't be just a 15-minute wait for some people, depending on how you answer those questions before you get your shot. There could be a 30-minute wait too. And right now, staff members that are pregnant, they're not giving the vaccine to pregnant individuals right now.
So that's actually very good advice about if you've got some questions now about whether or not you should take the vaccine, going to your healthcare provider. So let me ask, we were talking about Lexington Medical Center being a provider. If they are our partner in the vaccine, does that mean that if I'm a Lexington 2 employee, I can't go to a pharmacy, for example, if they're offering it? Should we all go to our partner hospital?
Once we get approved and we get into where the legislator moves us up to 1A or 1B happens where educators are part of that, you can go to the VAM system and sign yourself up. I don't know anything about how you can prove that you're an educator, so make sure you got your teacher ID or your school district ID to take with you like that. But yeah, you'll be able to sign up and you can pick and choose, because the folks that have already gone through that I know pick and choose different places to go. I know the Armory here in this area has been given vaccines, and some of our employees that qualify already have been going there. Lexington Medical Center, it's on the side where the auditorium is, and it's really well organized. Most people say they're in there about 20-25 minutes, and most of that time is a 15-minute wait time to see if you have any reaction.
So, Dr. Wade, will the plans change? Is there anything in the plans that changes depending on whether you're getting a 1-dose vaccine or a 2-dose vaccine?
Obviously, plans can change if the last year has taught us anything. Obviously, logistically speaking, in terms of, the amount of time and resources it would take, if there was a single dose available, obviously that'd be preferred, because, you're just one and done. If it's 2 doses, I think that's something we'd have to evaluate, because we know we can do it, and I think it's trying to make sure, do we want to take up that amount of time on 2 different occasions, and I think that's something we would have to discuss. We know what we ideally would like, but I kind of want to say, beggars can't be choosers, so I think we're going to have to adapt.
How are we gonna, and this might be something that's still in the works, but do we know, are all the teachers, we've got this facility that we can drive through to get the vaccines, are we gonna have most of our teachers come through, on a single day, or how will that be?
So what we're going to be shooting for, and Mr. Hinton can kind of tell me if I'm misunderstanding anything, but I know we're shooting for a Thursday and Friday leading into the weekend, so that way in case there's any issues from taking the shot, at least then we kind of have the weekend to work through. And at that time, we'd also be under a district-wide period of remote learning to allow that flexibility to kind of have the vaccine administered. I think what's probably important too when we're kind of talking about teachers, employees, because right now what we are hearing, so I want to stress that, what we are hearing is that under 1B, all the different employee groups in education are to be prioritized. Like examples were given that classroom teachers and support staff would be prioritized because they're chronically exposed to students, and superintendents, because I guess we are useless, we'd be dead last, and that's understandable. And but one of the things that I'm strongly advocating for and encouraging, and as we are making our requests, so if we hear we can get X number of doses, I'm going to go for probably around 1,500 doses, because I'm not just including the teachers and support staff, I'm including food services, our custodians, our maintenance, our bus drivers, board members, can't leave the 7 out, and we want to make sure that anyone, and volunteer coaches, student teachers, anyone who contributes to the learning environment should have access to that vaccine. So that's something that we're going to be encouraging, especially if we are able to have the benefit of actually administering it ourselves.
I know you're in a lot of meetings talking with educators and government officials, health officials. So do you have any sense of when the vaccinations might be starting, when we might be moving to 1B, or where teachers might?
You mean all those uplifting meetings and conversations? No. I think that's also why, it's kind of like how we haven't really been directly informed to officially have a vaccination plan. We keep hearing about it, but we're not actually told, nor do we, we're kind of working with the guidelines that we have available to us through DHEC. I think that's why we just have to be ready. because I definitely do not want any of our employees to lose out on the opportunity of receiving it because we were not prepared. And, you know, I'm not going to participate in this blame game when it eventually happens. You know, I want to make sure that we are good to go, and I feel very confident by our plan that we would be.
Anything to add?
We're going at it with a purpose of whatever scenario they give us, we can act right away. If the slowest process would be is we go through a provider. But our part there would be going in and helping any individual staff member who wants to sign up, who may have trouble with that website. And by the way, if you go to the VAM system, you can only use Google Chrome. They don't publish that on the CDC, but you have to use Google Chrome. We can go in and help them sign up. If we can get the vaccine and be able to administer it ourselves, our school nurses, then we can do it in 2 days, and we feel pretty confident and able to do that. And we would do it at the Community Education Center. We could run 5 lines and get everybody through. The thing about the car we'd have to do is we'd have to look at the space as far as you got to wait 15 minutes, and we may end up having more cars waiting 15 minutes than we have space for. So we may do it inside, depending on whether to. Plus the cold storage would be down where the cafeteria used to be, where we would end up doing that.
And we may even have to schedule it, where we might have to, over the course of those 2 days, saying this building is able to attend, and then, you know, here's the timeline, and work that out. You know, do some chalkboard math.
Right, and so you were saying, Mr. Hinton, at the Community Education Center, that's the old BC Grammar
That's the old BC
School.
Grammar School.
Okay.
And we would use the old cafeteria, and we'd set up 5 lines. We'd have multi-nurses on each line to do the screening, loading the vaccine into the syringe, and then somebody actually giving it. We want to make sure they understand that day when they come, we want them to wear a mask, and we want to wear a short sleeve shirt. We don't want to have to be rolling up sleeves or anything. We'll just be a process. But doing it on a Thursday and Friday, if anybody has a reaction to it, we've heard of people having headaches, we've heard about people being sleepy from it. That gives us the weekend to get over it too, because I agree with Dr. Wade. We want to do everybody, so that would be our bus drivers and folks like that are around kids all the time.
Right. And so, and Dr. Wade, you mentioned that if we do it on that Thursday and Friday, that would be a period of remote learning likely for our students?
I probably wouldn't say likely. That will happen.
Okay.
Yeah, that will happen.
Okay. And then, Mr. Hinton, you took one of my questions. So did I hear you say that our school nurses would be doing the vaccines?
Right. We had a meeting through the South Carolina School Board's Insurance Trust, and they talked about the liability of school nurses giving the vaccinations. And there's a Public Readiness and Emergency Preparedness Act. It's a federal act that's been invoked to 2024 that will cover people providing the vaccine. There'll be just some online training for them to do. The biggest thing we need help with, besides the syringes, is if we give the vaccine ourselves, I need a doctor that will come in and write the order for our nurses to do it. DHEC did it before. Their doctors did it when we did H1N1 a long time ago. But right now, we don't have a doctor. And if we could secure that doctor and keep working on the syringes, that we have all the parts in place waiting if they're going to let us have the vaccine or not. And before coming over here, Johnson & Johnson got their first approval of 2. That's the single-dose vaccine, and we've already got orders in it. The federal government has orders for it. So within a week or 2, I think it'll be, if it goes through on Friday, it'll be available for distribution. So that could speed up the process as well.
What have you heard, Mr. Hinton, about vaccines for students?
They just started human trials on a nasal spray. There's one pharmacist, drug group down in Alabama working on one for the United States, and then there's one in England. And when we started giving H1N1, if you're old like me and remember that, we started out with giving the shots, but then they actually got vaccines in, and so you could actually have it a syringe and you just have the kids inhale it, which we went a lot faster with it. So they're thinking summer to late summer, they may have it ready to distribute. We're hoping that it'll be available for kids. We don't know that for sure. They're also doing trials with pregnant women as well to see if the vaccine's safe for them to take too. Johnson & Johnson started another trial saying, what if we gave you a booster shot, a second vaccine down the road with it? Would it make it more than the 80-something% that it is effective now?
So stay tuned on vaccines for kids.
Right.
More information probably to come. So is there anything else, anything I haven't asked you that you want our families, our community to know about regarding the vaccinations?
No, I mean, I think it's one of those things like, even though we've been talking about our employees, and obviously right now, as I think Mr. Hinton was alluding to or said, that there's not that broad H1N1 order like that happened last time. But I think it'll also, by doing our employees, like we'll know what's working and what doesn't work. And, if schools are going to be expected to, assist or have the opportunity to and kind of helping out on a larger scale, at least we know what can kind of work on our front and be part of that larger conversation if needed, at that point. But I think Mr. Hinton and his team, they've done a great job of kind of going through everything from even making sure, that we have security available. We're having an EMT also on site, but also having, alarm to notify us if the cooler somehow does, break down or something, and I think we've really thought through a lot, and we kind of look forward to the prospect of being able to kind of help out our employees, because I know it's definitely something that's been weighing on everyone's minds, and and I think if should the state decide to kind of like, let's say, move up all of our employees, and especially all as one particular group, and kind of put that added value to what everyone's bringing, especially with having us back 5 days face to face, we'll be ready.
Are we going to be sending anything any written information or emails to families about the vaccination plan that we've got?
Yes. So in terms of like what communication that everyone will be receiving, I know we're recording this on a Wednesday. Tomorrow is our board meeting, and we're providing in writing what our plan is, and in wonderful paragraph form for everyone. That will be made available after the board meeting on our Lex 2.0 page, so then people can go there and access it. But we'll definitely be communicating with everyone as we kind of get closer. I think it just gives everyone an idea of what our plan actually is. But obviously then when we can kind of put that into action, we'll try and be sharing as much more as we can. But at least we kind of give everyone an idea of what to expect.
And that's a good point. Dr. Wade, you say this a lot around the office. We've got the plan, but always stay tuned, because everything with COVID, from day to day, there are new developments and things, change. So just stay tuned. We will keep you informed through Lex 2.0 on the latest with COVID, vaccination plans and such.
One more timeline thing. If
Yes.
we use the Pfizer vaccine, we have to wait 21 days for the second dose. If we use Moderna, it's 28 days for the second dose.
And we'll know when we're getting those, and you'll help us.
The more difficult
Schedule,
one would
okay.
be the Pfizer, because we don't have the freezer that goes down to 80 below zero, 90 below zero, whatever it is. The Moderna is can be in a cooler, and we have the coolers that can preserve that for 30 days.
And I think that's why there's so much attention of the Johnson & Johnson, with that being a single dose, and a reasonable temperature.
Right.
So, that would be, I think, a game changer in general.
Yeah.
And Mr. Hinton, who is our resident expert and keeps up with all related to the vaccine and COVID, we are a lucky district to have him following all this. But I just asked Dr. Wade if he had anything else he wanted to add. Anything else you want to add?
Just be ready to go, because we're probably going to get the word and have just a handful of days to get prepared for it. And everybody's going to have to be a little flexible and be ready to go at a moment's notice. But we're trying to do as much ahead of time. So if we could find us a doctor that would sign off, as well as finding those syringes, we would be steps ahead of most districts.
Okay, so be sure to look this week at Lex 2.0 so you can get a firsthand look at the vaccination plan in its current form. And if you have any questions, send them to the website. Go to the lex2.org website, and that will come to me, and we will get them answered for you. So appreciate your time, and have a good day.